Hello everyone, my name is Dr. Akram Ahmad. So I'm talking to you guys from Australia, Sydney. So today's webinar is for you regarding the opportunities in abroad, like UK for PLAB and USMLE for US and AMC for Australia. So in these three countries, if you have any questions or any doubt, you can discuss at the end of the webinar. So I'm just going to share my screen so we can start. Abdul, are you able to see my screen?
Yes, sir. Yes.
Okay. My voice is clear?
Yes, sir. Clear.
So guys, we are going to discuss PLAB, AMC and USMLE. And you also can ask, the like comparison of all these three countries or exams pattern, and so there is two things for you since you are maybe in final year student that you're planning to work, you want to earn the money or you want to go for PG. So if you want to go PG directly after your MBBS, so the best route for you to go USMLE, I highly recommend it. But if you want to earn the money after MBBS and then after some time you want to go for PG, okay? So you are not sure which branch you want, so you want to develop your own interest. So in that case, AMC highly recommended. Come to Australia, you can start working here. My voice is echo.
Sir, actually, there is speakers connected in the auditorium, right? So from there, yeah, that's what echoing. You can just ignore that if possible and
Okay,
continue with the presentation, sir. They are able to hear you loud and proper. That's what.
okay. Thank you. So if you are planning to go for PG, directly you can choose USMLE, or else if you want to earn some money and you want to go in PG after 2 years, okay, then in that case you can choose AMC or PLAB. So AMC is highly recommended because after part one, the AMC part one, if you can clear from India itself, and then you can start working in Australia. So you are eligible to work in Australia. So if I compare in these three countries, you are not allowed to work in US or in UK after part one exam. Only Australia allowed to work after part one. Okay, so in UK you have to write PLAB 1, PLAB 2. Then you have to start looking a job and go to their work there. And same for USMLE part 1 and part 2. Nowadays even people are given part 3 when they are starting looking for their PG residency in US. But in Australia, you just need to pass AMC Part 1. You can start working here in Australia. So at Academically, we are an Australian company. At Tech, basically, we provide assistance for all healthcare professionals looking to migrate abroad, like medical doctors, dentists, pharmacists, nurse, lab technicians, physiotherapists, optometrists. So any healthcare degree holder looking to migrate abroad, so we provide A to Z assistance. So this is a little bit about me. So I think Abdul already gave my introduction to you guys. So I did my PhD from University of Sydney, and now I'm working there as a lecturer earlier. So I recently resigned. So now I'm full time working as a CEO of this academically. So we are basically trying to create the awareness among Indian medical professionals to migrate abroad. These are some of the faculties for this course. This is Dr. Sipin Sharma. She is an Indian doctor. She completed MBBS MD from Pune Medical College, and she passed this AMC journey. Now she is working here in Sydney. Same for Dr. Udara. She is basically from Tamil background. She's from Sri Lanka, and she passed this AMC journey. She's working here in Sydney. And same for Dr. Amanullah. These are some of the faculty for this course. We have two more faculty for this course for AMC. So opportunities for you in Australia. So basically, I'm going to in detail about the AMC. but we can compare wherever need for PLAB or USMLE. Okay, so you can make your, or if you can just, if you have any doubts, you can note down your questions so you can ask at the end of this webinar. So in Australia, they provide PR visa, permanent visa. Australia provide 190,000 P visa. So once you pass this process, you are eligible to apply PR and you can migrate to Australia with your family. So PR visa in general, they will give you for 5 years, and after 3 years you can become an Australian citizen if you want. If you don't want to get citizenship, you can renew for another for 5 years. You can renew as many times you want for 5 years, and you are a PR holder and Australian citizen. So the only difference in PR and citizen as an Indian, uh, we cannot give a voting right, not be there in India. So if you got a Australian citizenship, still you can go to India, you can live there, you can, if you want to open your own clinic, if you want to build your hospital, you can, except the right that you cannot the vote and you cannot buy the land in agriculture. Rest of the rights will be the same as like Indian citizen for you. So around 10,000 job vacancies currently available. As a lot of GPs need. This is basically AMA report, Australian Medical Association. The report shows this GP shortage are going to increase in future. They need lot of doctors in Australia, and this gap only can fill by IMGs, international medical graduates. So that's why earlier a lot of medical doctors, they want to go for USMLE or PLAB only. They don't know about the AMC. But nowadays, a lot of Indian doctors, they are migrating to Australia as well. And salary is very very high as compared to UK and US in Australia. So if I compare in UK you cannot get the PR directly. You have to work for 3 years and live there for 3 years. Then you have to apply PR visa, permanent residency. Then you have to go for citizenship. So it's a long journey in UK. Same for UK, to getting a green card is nearly impossible nowadays. Recently, there's one published one report for Indians. There's a very long, basically, queue is there for a green card. So getting PR very easy in Australia compared to this UK and US. And job vacancies also, number of vacancies are available, but vacancies are available in all these three countries. There's a shortage of doctors, I can say. And yes, salary is very high as compared to UK in Australia. So Australia paying around 30 to 50% more salaries compared to US and UK. So this salary actually is based on, there's even one website called seek.com.au. This is number one website in Australia if you are looking a job. So you can go and have a look there. So they are saying that average annual salary for general practitioner jobs in Australia and 380,000 to 400,000 Australian dollars. So it's going to be around 2 CR per year. And once you pass this part one, I will explain you in the detail in my next slides regarding this uh, the steps you need to take. So once you pass part one, then you are eligible to apply as a work as a JMO or as a RMO. So what is the mean this JMO or RMO? Junior medical officer, basically when you are doing your internship in India, so legally you are not allowed to give prescription for the patient because your registration not yet done. So you are allowed to practice in India once your registration is done in your state medical council, right? So here, after part one, you will get a partial registration. So in that case, you can work under a supervision of another doctor. Okay. This is a different, and you can work in any clinic, in any hospital. So a lot of emergencies, basically, they hire for JMOs or RMO. Okay. So after part one, you are eligible to work in this. And yeah, so the salary is going to be around 80 to 120,000 Australian dollar per year. Easily you can get this. And on an average, if you see, this is the one of the website is showing that around 110,000 Australian dollar you can earn easily in Australia as a RMO in Australia. But once you become a GP in Australia, so how much money you can make? I'm not talking about the specialist in like surgeon. Surgeon can make up to 600,000. The highest earning in Australia, this is a neurosurgeon, highest they earn up to 6,100. I've recently make video on this on my YouTube channel, so you can have a look at that video. And then basically surgeons earning is high here, 400 to at least 600,000 they earn, and especially even orthopedic surgeon and all those things. So in Australia as a GP, so maximum patient you can see 60 patient per day. This is the maximum patient you can see in Australia. Uh, in the government, here is the government funded system healthcare in Australia. So government, as a patient, I no need to pay anything to the doctor fees. The doctor need to charge this fee to the government directly. Okay, so the government will pay to the doctor 21 to $250 per patient. This is based on the patient condition and what the procedures you are performing. Okay, so on an average you have to need to work this 5 days and 40 hours weekly, 8 hours per day you need to work for 5 days. Okay, so many doctors basically, they do not want to take a lot of headache in their. So in that case, if you want to life like peaceful life, okay, in that case you can go for to become a GP, and in this you just need to work 9 to 5 in the evening time, so no need to much worry in the night shift and this all those things. So if still you can make a very decent salary, I can say around 12 to 13 lakh Indian rupees. Even after tax also you can be get around 10 lakh plus salary. So in general, in Australia, if you are working Monday to Friday, you will get normal salary. And if you are working after hours or Saturday, for example, someone is working on Saturday, you will get 1.5x salary, and plus after hours. After hours means after 6, 7 p.m. basically, if you are working in Australia, so you will get the 1.5x salary. Or if you are working in Sunday or any public holidays, you will get the 2x salary. For example, Sunday or any festival is there or any public holiday, in that case, you will get the 2x salary for that particular day. This is the on an average salary up for you. So there are the other advantages to migrate to Australia. First is the education for kids are free. So Australia, one of the top universities in Australia, you can say. So if you see that University of Sydney, they have medical school. So this medical school, from where I did my PhD, Sydney Medical School. So this is one of the oldest medical school in Australia. The first university, first college they established in Australia, Sydney Medical School. It was established in 1849. Okay. So this college have a rank around 13 in between 15 or 16 sometime, like global ranking I'm talking. So in Australia, this is the number one school and globally also very reputed school this. So healthcare is free here and education for kids is free in Australia, and professional development. While you are working in Australia, if you want to attend any workshop or you want to present some any research or something, in that case the hospital will pay all these bills wherever you want to go to present all the things. And work life balance, as I mentioned, that you have to work only 38 to 40 hours weekly. As you are medical student, you already know many doctors in India sometimes they have to work maybe 48 hours continuously, especially who are doing PGs is very common in India. And career opportunities. So fast track PR visa they are given because there's a lot of shortage for the medical professionals in Australia. And quality of life obviously is very high and high earning potentials in Australia. So these are the steps you need to take in order to register and you need to register yourself in Australia. So first step called documentation process. So we will help you to complete this process and it may take around to complete 2 weeks. Okay. And then number two step, you need to write this AMC Part 1 exam. This is a multiple choice questions. They will ask you 150 and 3 hours time. And there is a 15 exam centers currently in India. In every month, you can write this exam. Okay. And once you pass this exam, you will get a limited registration. So you will allowed to work as a GM or RMO. So you just need to work in pass AMC Part 1 plus English will also help you to complete it. So we will provide you the 4-month coaching for AMC Part 1. So many students ask me the question that, sir, how much time basically required to pass this AMC exam or USMLE or PLAB? So our syllabus, like is this 4 month is more than enough to pass this exam, and more the advantage for Australia, whenever you are ready, you can just book the exam. You can write because this exam they conduct yearly 10 times. So every month they conduct this exam for AMC. In case of PLAB, okay, so PLAB also have documentation process. This is you have to make a portfolio on GMC website. We also help you to complete that process, and then now you want to book the exam for PLAB. So PLAB might take like there is a long queue. You have to wait for at least for 12 months to 18 months to get the seat in UK, and US also similarly very competitive nowadays. But in Australia, monthly they conduct, so there's not much waiting for this. Okay, and after this, you are eligible to work as a GM or RMO in Australia, but UK you cannot work. In US also you cannot work. But after this, you need to write AMC Part 2. So many doctors personally they ask me this question that, sir, AMC Part 2 little bit tough. So what is the passing rate or passing criteria for this exam? And is there any alternate for this? Can we do something else if we are not able to pass this AMC Part 2 exam? So AMC Part 1 passing rate up to 70%, same like USMLE and PLABs. There is not much difference in Part 1, but Part 2 AMC little bit low, around 30% student pass in their first attempt. Okay, and the good news is for you, you can go WBA program. It's called work-based assessment. So as you need to do internship in India after your MBBS, same like you have to work here in Australia. So you are working and earning simultaneously. You can do this work-based assessment. So they will. I can say here is a 99% student pass in this work-based assessment in this. So you can go for WBA instead of AMC2. Okay, and there is a 19 hospitals identified for this job, this WBE, so you can apply on those hospitals for a job. So without passing AMC Part 2, you can get a full registration in Australia. Okay, and now once you got full registration, then you have to do at least for 1 year internship, or we can say you have to work as a RMO in Australia after this Part 2, or if you are working previously in Australia, so that AMC might give you the waiver for you. So you have to work at least 1 year in this system to get your full registration. And after this, if you want to do any PG in Australia, you can do. So PG, as you know, there's a clinical and non-clinical. So if anyone want to do a non-clinical course, for example, you are an MBBS student now. You are looking, okay, I will take a admission in like public health, master of public health, or hospital management, and I want to come to Australia. So those courses cannot give you the PR visa and job, most likely. But if you can clear the exam AMC during that time, so obviously, but it make the easier journey for you. Okay. So far, any questions? Okay, let me.
Till now, any doubts, students? Any doubts till now? So you can move now, sir. Next.
So here the WBA program, work-based assessment, as I mentioned, this is government of basically Western Australia. They are providing and they are asking those pass this AMC Part 1 exam. They are eligible to apply. They can start looking at job. Yeah, they can apply basically this pathway. So there are so many websites. I think Abdul can show you after my this webinar, so he can there is a they are the basically government website. So for example, in India we have like Pondicherry government, maybe Tamil Nadu government, Karnataka government. So this government always hire health practitioners in India, right? So here the same like state wise there is agencies they hire. higher professional. So you can see lot of vacancies are available for JMOs or RMOs. So once you pass this part one exam in Australia. So exam centers, exam they conduct 10 times yearly, except December or January, there is no exam, except like then February to November. You can write whenever you are ready to go into the exam. There is 15 exam centers currently available in India. English proficiency test is mandatory for you to register as a healthcare practitioner. So IELTS, OET or PT, any test you can give. These documents required for part one documentation process like your degree, transcript. Work experience is not mandatory, but if you have any, you can show valid passport, government ID proof, passport size photograph, medical registration. Since you are from India and you are Indian graduate, registration you can show. But if you are not yet registered, still you can start your process. Okay, you just need to get the degree only. Okay, once you got your, even if you got a provisional degree, you can start your process. So in AMC exam, they will ask around 150 multiple choice questions and 3 hour times. And importantly, there is no negative marking for this exam. So you need to attend all 100 questions. Even if you leave some questions, then your paper is not going to be evaluated. So you have to attend all questions. Okay. And there is a scale basically to pass this exam 0 to 500. So if you got around 250, you will pass this exam. So we can say around 50% only you need to score to pass this exam. While for PLAB you need 60 to 62%. For PLAB UK needs 60%. Same for the US Assembly as well. So for Australia around 50% if correct, you are eligible to pass. So here the each question have their own weightage. This is not like fixed marks. One question might be for 1 mark, another question might be for 2 marks, another question might be for 3 marks. Okay, so you have to attend all 150 questions in order to pass this exam, and even they will not mention in all those things. They will count when you pass this exam. This is basically a computer-based exam, so the computer will, the system will, see that whether you pass the exam or not. We will provide you the coaching around for 4 months to pass this exam, including the revision for last 2 weeks for on the previous papers. So we will give you the live sessions, live classes from Australia, and then give you the study material, and also we will give you the lot of mock tests on previous question papers, and we have our Q bank. So you have for the practice yourself. So we'll make your journey very easy. So 4 months is enough for you to pass this exam, this AMC part one. So once you complete this process, then you are eligible to get PR visa, permanent visa, 190, 186, 189, all these PR visa you are eligible to apply. And work visa also you are eligible to apply, like 482, 494, and 491 regional sponsored visa. And here are some of the media coverage about academically. Uh, I think fees will Abdul will you can ask him directly. And we provide financial loan facilities, so you can pay the fees in 3 installments, 6 installments, 9 or 12 months, so without paying any interest rate. We have a partner with Radio Ones from India. This is only for Indian citizens of this scholarship we also provide. And these are some of the reviews from our side. So that's all from my side. Now we can take some of the Q&A session. So if you have any doubt or questions, please ask.
So anyone have doubts? So you can directly interact with Dr. Akram and clarify your doubts. Please, anyone, raise your hand so that I can give the mic to you.
So this is not just AMC. You can ask even PLAB or USMLE or AMC, anything, any questions regarding these 3 countries.
So students, make use of it. It will be very useful for your career. Kindly ask your questions at least with me so that I can interact and help you. You can question me also.
So you guys are in Pondicherry, right? This college, Abdul?
So, Mahatma Gandhi Medical College, sir.
It is in Pondicherry?
Yeah, it is in Pondicherry. Yeah.
Okay, I have been there. Basically, there is a one professor in community medicine. There was a one workshop regarding the research methodology in biostatistics. And it was in 2013, 13, I think. Yeah.
Okay. Great, sir. So, sir belongs to Annamalai University. He studied his formed in Annamalai University. He is very renowned person in India.
You guys can ask any question if you have any doubt. Anything regarding Australia, UK, US.
So don't interact with yourself. You can ask me also. Still many are sleeping, right? Say anyone, brother? Any doubts? Don't be shy to ask questions, right? Any doubts, ma? Do you have? Doubts? No. That's it. Do you have
Abdul,
any
you can
doubts?
Abdul, you can see many people who will be asking with themselves. So
Yes.
I would I know that what students do basically when you are at the college. Nobody knows about that. That we are pretty much sure that is the reason by which there's an exclusive webinar that has been conducted for you only, right? So the complete effectiveness for the same only can be achieved if you are asking those questions to us directly, right? Any question it is, like the very basic questions to the most advanced one, we are ready to take up that questions. But you will be having a better understanding only if you ask questions, right? So I could request at least one or two, maybe a representative from your batch could ask the questions for behalf of you, or if the faculties are present over there, they can ask on behalf of the students that they might ask them in the future also.
This side, do you have any questions, ma? Right? No? Everything clear? Sir, can you give the comparison between AMC 2 and work-based assessment? The difference once again, sir.
Okay.
So
So AMC2 or PLAB2 or this USMLE2, USMLE theoretically you can say, is called OSCE exam. Okay. There is several stations is there and they will give you small task and you have to perform and there is some lecture as observing your skills, right? So this is kind of, this is lack of Indian medical graduates. But in WBA, you can whatever you are doing basically internship in India, you are working as a CRI, right? So same you have to work in Australia like as a CRI. While you are working, your colleagues, especially like nursing department heads, for example, and that unit head is there, So all this they will see your observe in those particular. For example, if you are working in surgery for 2 months, over those 2 months they will give you a report about your skills. There is no exam kind of thing. It might be a kind of viva things, at the end of this. As I mentioned that 99% students pass in this. So if you are very good with your colleagues in that, what definitely you can clear this WBA program. So there is no written exam or something in that. This AMC2, that this is the exam. There is no exam for WBA, but in that unit, if you are working, because you have to choose at least 4 to 6 different departments, you have to work for there. For example, if you want to do residency in surgery, so you have to go for surgery mandatory surgery like pediatric or option gynae on internal medicine. So you can choose at least for 4, and you have to go for 2 months in this 4 rotational. You have to work there, and these unit heads they will see your skills, and they will give you the certificate kind of thing. Then they will give you the final certificate, and based on that certificate, you have to apply for your full registration in Australia. So similar, this is like kind of like when you are working, like in India, the same thing you can say you have to work here.
okay, sir. Thank you, sir. I think I'll be just discussing with them, sir, post this
Yes,
section.
yes, yes.
And I will also ask them to give the feedback also.
Yeah,
So that
sure.
we can interact one-on-one. Yeah.
Yeah, sure. You can talk in Tamil maybe for some time.
Yeah, sir, sure. Sir, can we wind up, sir, as of now? Hello, sir.
Yes.
Yes, sir. We can close this session, sir. I will just discuss with them, and we
Okay.
can
Okay.
get the feedback
Okay.
also,
Okay.
sir.
Thank you. Thank you,
Thank you, sir.
everyone. Thank you. Bye.
Bye, sir. So, Tausif sir and Shiva sir, we can wind off now. Okay.
Yes, yes. Okay.